I am Dr. Nikki. Nice to meet you.
Nice to meet you.
Just to let you know that this is going to be recorded so that way I can keep my full attention on the questions that I'm asking you, and then I will go back and reassess that after you leave, and we can hopefully have another session. So you are here today. You filled out a questionnaire before you came and saw me. I see you are 39. Yeah, okay. And your wife is the one who suggested for you to come see me.
Yes.
Is there a reason why?
She thinks that I'm angry all the time at certain things. So.
Okay. Like what kind of certain things, I guess?
I don't know, just like everyday stuff that's troubling.
Okay. Why do you think you want to be here? Or do you not want to be here? You're just doing it for the sake of her?
Well, no, I'm doing it also to benefit me into maybe getting a grasp on how I should maybe handle things differently.
Okay. By this, it says that you had counseling in the past.
Yes.
Okay. About how long ago was it?
Maybe 4 or 5 years ago.
Okay.
Somewhere in there.
And you don't remember who you saw or anything?
No,
like
I don't.
Okay. By what you have on here, it says you had a good experience.
Yes.
Okay. And you stated in here it helped you to get things off your chest and to get ideas on how to help with your problems.
Yes.
Okay. Not taking any medications. That's great. Never been in the hospital for mental reasons or substance abuse. That's great. Let's see. So you kind of explained a little bit on what you hope to get out of the counseling itself. Was there any other things that you maybe were looking for, or things that maybe that you didn't know up until now, maybe, or?
No, just here to get it more of a line of direction, line of sight.
Okay. So your strengths: open-minded, big shoulders, and patient. Those are some pretty great strengths. And just to kind of go off a little bit of that, that's maybe another reason you might possibly be a little short-tempered a little bit. Okay. What about some weaknesses?
Off the top of my head, I can't really think of anything. Probably don't listen as well as I should have.
Excuse me.
Stubborn, once in a while.
Okay.
Stubbornness.
Yeah, there's a lot of people in this world that have a lot of those weaknesses, and but being able to admit them, that's good. That's a good thing. So that's one of the benefits of going through or even talking to somebody, is that you can identify some of the weaknesses that you do have, and maybe we can help you with some of them too. Brief family history. Your dad had a lot of different health problems. I guess, like what? Like, what was he dealing with?
Well, he had weight issues. He also developed a tumor in his head and had that removed. And after he had the radiation treatments, he within a year or two, he developed psoriasis over and passed.
Okay. How long ago was that?
So he passed in 2017, I believe, November of 2017.
Did you get to see him at all before he passed?
Yes.
All right. Did you get some doors closed and maybe some issues resolved with that, or?
Yes.
Okay.
Yeah, there was definitely time to work things out before not getting to see him again.
Okay. Well, that's good, because there's a lot of people that don't ever get that chance.
No.
So, you're pretty lucky on that one.
Yes.
What about your mom?
My mom has actually been through a lot too. She was in a bad accident where she ended up in the hospital for a long period of time, multiple surgeries, and stuff. And then she kind of developed taking pills to make herself feel better all the time.
Okay.
And I'm not sure if that was depression or whatever, but I recently discovered that, and it was kind of a little bit troubling and bothered me quite a bit.
Okay. Is it something that you've talked to her about?
Yeah. We have had the discussions. I feel that she's better now, but I can't be sure if she's changed her ways.
Okay. She doesn't live around here?
No, she is with her mother down in Arkansas, helping her.
So your grandmother?
Yes.
Okay. How's your grandmother doing?
She's doing very well. She's gone through a lot of stuff here in the last year. She lost her husband, just died of old age, and she also slipped and fell on the ice and hurt her hip and her shoulder, and went through physical therapy and all this other stuff. And then here not too long ago, she had a mild stroke, but she's 92 and still kicking. So.
Okay. Well, so with your mom now, she's taking care of your grandmother, no other help?
She's not getting the help that she should be from my mom's siblings. Her brother and her sister don't show up as often as they should, but I know that Orville, her brother, he does do a lot when he can.
Okay, well, that's good. And was there anybody else helping you when you found, or how did you come to find that she was taking all this medication that she wasn't supposed to be, or things like that? How did all that come about? Did she just come out and tell you, or?
Actually, it was when we were down visiting my dad. My wife showed up to also be there with us, and kind of we were snooping around, and we discovered multiple pills that probably should not have been there, didn't need to be there, and kind of thing. And then, talking to Dad, and he kind of opened up and said a few things, and then we put two and two together and figured it out.
Like outdated stuff, things like that, or just random?
Random, I think. I don't remember any outdated stuff, but I'm not saying can't rule it out.
Okay.
But
Well,
it was very troubling seeing medicine bills everywhere.
Yeah.
Not bills, bottles of pills.
Yeah. Oh yeah, I'm sure it can be. Did you say anything to her then and there, or did you wait?
I waited until after Dad had passed, and then I brought it to her attention. Okay. She had just, at the same time, she had surgery while Dad was sick, and there was a lot of hard feelings there. So, because I felt that she should not have had the surgery until after he had passed.
Okay.
So.
Okay. You have on here the history of abuse. So you have a brother? Yes,
I had a brother.
Okay.
Jerry passed away. I think he was about 41, and he was actually into the drugs. Don't ask me what kind of drugs, because I really don't know. And he was also, I'm not sure the correct word to use, but he was gay.
Okay.
So there was AIDS involved as well.
Okay.
And a lot of from what I've heard from the history of my mom, when she first married my brother's dad, he was an abusive man, and there was what ended it was when my mom caught him abusing him. sexually, and there was problems there.
Okay. So you never knew this man.
Nope.
You just had Jerry as your brother.
Yes.
It was just
Yeah.
okay.
He's the half brother.
Half brother.
Yeah.
And he never obviously he didn't do anything to you.
No.
I mean.
No.
Okay.
No. He was pretty straightforward, nice guy, and did everything up to a T until I don't know when all this stuff came about. I don't know how it was.
Okay. No legal problems. That's a great
Nope.
thing.
Yep.
What do you do for a living?
I drive truck and work on equipment and stuff like that. Just kind of floater at work.
Okay. So when you're in your truck, you're normally by yourself.
Yes.
Okay.
Yes.
So
And talking to yourself in the truck as you're driving blows other people's minds, but sometimes it just helps.
right.
It's more scary when you answer yourself.
That's okay. Sometimes you need really good advice.
Yeah.
So you ask yourself your own questions. So before, do you talk, besides talking to yourself, which there's nothing wrong with that, is there like anybody that you would talk to? I mean, do you call your wife? Do you call, I know your father has passed away now. Do you call your mom? Somebody or, something along those lines, a friend, anything like that?
Yes. Well, I have been driving truck for over 19 years.
Okay.
And before my dad passed and when he was retired, used to call him constantly and talk to him almost every other day.
Okay.
On my mom's side, as of right now, I call her as much as I can, but she's busy. And I do, I talk to my wife and friends here and there, or my youngest child or my oldest child.
Oh, okay. So you have 2 children?
Yes.
Okay. Sorry, I didn't ask about you
No,
before. I guess I'll have to redo my sheets and ask that question on there to see if there's any family members other than your wife or your spouse on there. How old are your kids?
The oldest one is 22 and my youngest is 12.
Okay. And then girls, boys?
Both boys.
Okay.
And in the same situation, I'm more of a stepfather than the real father of the oldest, but the real father of the youngest. So,
okay, so kind of like how your brother and you
yeah.
were. Okay.
Yep.
Okay.
It's almost scary. It's the same cycle.
Mm-hmm. Yeah. How well do you get along with your oldest son?
We have a difference of opinions, but at the same time, I don't disagree with him on some of the things. Typical, you know, father-son issues, whatever. Dad doesn't know what he's talking about, or great, he's being a pain in the butt again, or
right.
Simple things like that. But nothing harsh, nothing physical, nothing violent.
Okay.
Just more frustrating trying to get him to listen and do the right thing.
Right. Okay. So your relationship with both of your kids is a good parent-child relationship.
Yes.
Okay. It's
yes.
not like, hey, I'm your best friend.
No.
Okay.
No.
I'm the authority figure and.
Yes.
Okay. All right. That's a good thing because in this day and age, we don't see a lot of that. And you always have your parent that wants to be that best friend.
Yes.
Type things like that. So how long, you've been married for how long?
Just a little bit over 12 years, 12 and a half years.
Okay.
12 or 13.
Okay. How is your relationship with your wife?
We have our ups and downs, just like every other marriage couple. She's gone a lot. She has a full-time military job, so she has training that has to do with a lot of things. So that puts her out of the house a lot. And then with me being in the truck constantly, we don't get much time to see each other. It's more of probably in this day and age that I hear from everybody is a phone relationship. So, other than that, we've had our differences and just like any other two people. So,
okay.
Nothing bad to say.
Okay. Well, that's good. Well, is there anything else that you would like to talk to me about today? And then we could actually go and schedule another appointment sometime soon or anything like that.
No, I think I'm good today, but we can definitely schedule an appointment and meet again.
Sure. Sure. Well, it was great to meet you. Thank
Nice
you
meeting you
so
too.
much for coming in. I greatly appreciate it. And we'll see you probably next week.
All right, thank you.
You're welcome.
Bye.